All right, thanks, Mike. So like I said, welcome everybody. Today, we are focusing on human trafficking, substance abuse, and communities. We are welcoming Zozan Kucukaydin from PCAR, and then we are also welcoming Dr. Glenn Sterner, who is with Penn State University at the Abington campus. So I will turn it over to them to start with today's presentation.
Thank you so much. And Glenn, I don't know if you wanted to do a quick introduction before we get started. Nope. Okay. So hi everyone, my name is Zozan Kucukaydin. I'm the Anti-Human Trafficking Services Coordinator with PCAR. And today we're really just going to discuss a bit about survivors and substance use. How can we address their needs through multidisciplinary collaboration? And I'll show you some good examples of collaborative approaches and additional resources to check out as well. And then Dr. Sterner will take over with some insight on his research, and again, we'll expand on that collaborative piece. Dr. Sterner, do you have the PowerPoint, or would you like me to pull it up?
Yes, please. I'm having issues with it sharing on my computer right now. I apologize.
Okay, yeah, no worries. Just pull that up really quick. Sorry for the delay. Okay, well, let me see if I can start. Okay, can everyone see the slides? Just want to make sure before I move on. Okay, great. Okay. So we'll just jump right in here. Okay, what do we know about trafficking in substances? So, we already know about the well-established link between trauma exposure and substance use, that many survivors use drugs as a primary coping tool to manage overwhelming emotions and trauma-related symptoms. And this can be during the trafficking, even after exiting their situation. And we also know that many survivors with substance use disorder struggle with the emotional and physical health-related issues because of their traumatic experiences. And then to top this, survivors who use drugs are exposed to heavy social stigma, the stigma of their survivorship, the stigma of their substance use, the stigma of their mental health conditions, and then to couple this with a lack of specialized services, survivors faced barriers and difficulty with accessing those adequate services and support. And this, ultimately leaves them vulnerable to continuing cycles of addiction and victimization, right? So again, we'll discuss a little bit today what these survivors need and how we can work to dismantle those existing barriers as well. And then another thing we know about trafficking and substances is that traffickers can initiate substance use disorder, and they can use it as a means of coercion and control of the victim. And this is something that Dr. Sterner will expand on in a little bit here. And then we also know how traumatic experiences heighten the risks of being trafficked, but also heighten risks of developing an addiction, right? So survivors of trafficking are at particular risk for developing substance use disorder, and that's due to the high rate of PTSD within the community. So according to the American Addiction Center here, survivors of sexual abuse are 13 times times more likely to abuse alcohol and 26 times more likely to abuse drugs than those who have not experienced this trauma. And then to take this a step further, survivors of childhood sexual abuse or sex trafficking are put at an even higher risk of developing a substance use disorder. And we know that it's, because of the pervasive impact of these complex traumatic experiences that heighten those risks. And then, just to take this a step further here in our understanding of why survivors might use substances, the Office on Trafficking in Persons conducted a study where survivors identified self-medication, self-harm, or self-destructive behavior, reducing feelings of isolation, boosting confidence and self-esteem, and coping or escaping from the trauma as all of the reasons to which survivors use substances. And so, it's really not difficult for us to put ourselves into the shoes of someone who's who's struggling in this sense, just trying to get by. And we need to, keep in mind how systems of oppression create an environment where people turn to substance use to cope. And like this drug war era of messaging and policing will just not work when we're trying to reduce and prevent these issues. So again, just starting at the root of the problem and asking yourself, how can systems and collaborative groups work together to provide long-term stability and support, not just to, reduce hardship or social stigma, but to, increase our call to action and prioritize those needs of survivors. And we also know that there are major disparities among survivors of sex trafficking. And we know that LGBTQ people and BIPOC, which stands for Black, Indigenous, and People of Color, how undocumented folks and people with disabilities are all placed at a higher risk of trafficking when compared to their cisgender, straight, and white counterparts. Again, in the most general sense here, it's the lack of protective factors and the alarming number of risk factors that are put onto these communities that create these higher risks of exploitation and trafficking. So the National Center for Victims of Crime conducted this study in 2008, between 2008 and 2010, where they found that 94% of sex trafficking victims nationwide were female. Out of that, 40% were Black, 24% were Latinx. And again, this is from 2008 to 2010, so just, think about what these numbers might look like now. And then the study also found that in Louisiana, 49% of the child sex trafficking victims were Black, and even though Black girls comprise only 19% of Louisiana's youth population. I'll repeat that again because this one really stood out to me. So only 19% of Louisiana's youth population includes Black girls, and half of them were trafficked. And then another statistic in this report, it's not on this slide here, but it said that in South Dakota, Native Americans comprise only 8% of the population, but Native American women represent 40% of sex trafficking victims in South Dakota. So again, it's just really coming back to that need for us to center the needs of communities that are often underserved and disinvested in, and further our understanding in how these systems of oppression increase vulnerability and how they put people at risk of further traumatic experiences. So now that I just did a little quick overview of why survivors might use substances, how systems impact their experiences, we'll just, review here the identified needs of trafficking survivors with substance use disorder. And this is according to a study from the Journal of Substance Abuse Treatment. And the first here includes safe housing and prioritizing basic needs. We know this, right? But also, keeping in mind here that it's incredibly difficult for victims of trafficking who don't have their basic needs met to think about addressing that substance use disorder. I mean, if you're, you're still trying to survive, how can you possibly think about sobriety? And, again, you really need that basic need, and stability has to be first. And then the next identified need here is the is adequate residential and inpatient treatment options. So in Pennsylvania, we have many different inpatient and residential treatment facilities, but they all differ in terms of the kind of services they provide, and their intake requirements differ as well. So, I'm speaking from a victim advocate perspective here because of my experience, but and I'm sure you've all heard of this, when we're working with people with substance use disorders who say that they are ready for inpatient treatment, for example. I mean, your job is to rush, right, to help get this person get into the program, because we know that that decision, can change pretty quickly. So I was working with a sex trafficking survivor who was ready to go into an inpatient treatment program. And, she was so patient. We sat together for what felt like 3 full days before we got any answers. So, intake after intake, I'm told she's not eligible with little explanation, or we go through the intake process only to find out, well, she needs detox, but we don't have any detox beds. And so, just kind of bouncing around. And it wasn't until 3 days later that we're doing another intake. And the intake specialist tells me that my client is only eligible for one inpatient treatment center in all of Pennsylvania, just one. And that was because she had a seizure disorder, which required a level 4 treatment facility, which means that, the healthcare staff is around the clock, basically. And I think about, like, if I was already aware of these barriers, if I had known that the treatment facilities varied in terms of what level of care they provide, or, requirements, then maybe my list of places to contact would have been smaller. Maybe, we would have been able to get that client into treatment a little sooner. And then, I also think about how my organization could have responded to something like that. Maybe that looks like seeking a training for staff to learn and understand the resources that exist for people with substance use disorders, for example. So again, this is just something to think about, when we're working with survivors, when we're establishing protocols to address these gaps. What can we change within our policies and protocols that can work to eliminate those barriers for survivors. And then another identified need here includes individualized trauma-informed services, as opposed to a one-size-fits-all service plan or response plan. So really thinking about here, how we can incorporate more specialized services for survivors and really pay attention to that one person, their experiences, their needs, their goals. And then with our next 2 points here, survivors need low barrier services and extended care. How can we ensure that we're not just providing referrals, but that we're engaging with the survivor through that process of securing their needs? For example, I think about how case managers play such an important role in this, and how survivors who work with someone long term, they're more likely to experience positive outcomes because of that stability. And if a survivor seeking services, if as a survivor you're seeking services and you're just bounced around from one person to another, you have to retell your story, build that trust over and over again, then of course, you would struggle with making any sort of progress. And then again, that piece of extended care, what that might look like in our roles working with survivors. How can we advocate for extended care? And so extended care can look like maybe, more time with a specific service, or maybe seeing how we can expand our services to not only support the victim, but to extend that to their family as well, where, these efforts can actually reduce the cycle of trauma, victimization, and addiction within the family unit. So the study overall here really highlighted the need for further education and awareness for more service options and to really understand the role of low barrier services in addressing the needs of survivors of trafficking. So, just as I went over those needs with you all, this is where we can really think about what policies do exist within our organization and how do these policies and procedures impact survivors. You can sort of ask yourself and your team, how do these policies impact survivors with substance use disorder? Where can we advocate for change? How can we dismantle some existing barriers? And where can we prioritize that extended care and increase support and stability for the survivors we work with? So again, these are just some of the things to keep in mind as you're working with your team. Um, you know, uh, and while creating these anti-trafficking initiatives, we know that there are many anti-trafficking initiatives across the state. They're all great and wonderful, but there's always room for improvement and positive change to again meet those needs of survivors. And then this right here, this is from a healthcare perspective, but you can also connect this to really every single system that responds to this issue. So this socio-ecological model, I think, illustrates really well, this what these community responses can look like. So you have the individual level, where maybe you are providing training for staff, maybe you get them connected to resources that can help them in their role. And then you have the facility level or organizational level where you build and prioritize response procedures and what the initial screening process should look like, right? Just examples along those lines. And then the community level, which includes task forces, crisis response teams. You have larger collaborative groups where professionals from different fields and systems all come together, like the Regional Interdisciplinary Collaborative, or the RIC, we'll discuss in a little bit. Um, and that's where you share resources, you plan initiatives, right? But really, here is where you're building sort of from the top down in a sense. You're getting your team together, you're discussing how you can strengthen other areas of response, like the societal level, for example, increasing public awareness, advocating for funding and further data collection. But also, you're evaluating your screening tools, you're evaluating your response procedures. You are evaluating the awareness and training needs of staff. And so, you're looking at how all of this impacts the survivors you work with as well, right? And then overall, really just asking yourself if your organization isn't able to provide certain services to meet your policy needs, then where can your agency create partnerships to obtain those services, and how can those agencies work with you and vice versa? And then before I do go into some of these examples of protocols and collaboratives, I'll just, preface again by saying, that there's these great benefits for agencies to be working together to be collaborating, but we also know that it always comes down to the survivor's choice, who and which agency they want to work with. But again, it's our job to provide these options, to do what we can to eliminate any barriers, and to provide that victim with information of what services are available to them, and that's with or without the collaboration of other entities. So I'll just go over a few different resources here. I'm sure you are all familiar with the state's sexual assault and domestic violence protocol, but I just wanted to highlight a few things from these resources that I think would be helpful. So they have a human trafficking considerations section within both of these protocols, which are helpful. They provide examples of what thoughtful resources and referrals might look like. And then there are considerations for other special populations as well. And that includes trauma-informed responses for when you're working with, for example, male survivors or older adults or survivors in rural areas. And they both highlight that importance of incorporating an anti-oppression framework. So that's really helpful when you're developing a protocol. And these protocol guides are also very helpful. Or sorry, they're very comprehensive and provide you with detailed instructions when building your stop team. There's also specific points to keep in mind under each role within that collaborative group and ways in which you can incorporate trauma-informed approaches within your role as a member of the group. And then just again, how to best coordinate that response as a team. Um, and then overall, these guides really help you pivot and identify those key points when creating your own protocol. Like, what does the identification of survivors look like? What are the appropriate responses at different levels? How can we incorporate regular training to ensure task force members are aware of trauma-informed practices or any new data? And how can we work to raise awareness within the community and fill those gaps? So really just that important piece again here that everyone in the task force should have a shared understanding of the group's goal and what you're responding to. So if you're building a human trafficking response group or task force, then again, yeah, everyone should have that shared understanding of all aspects of human trafficking. And then I just wanted to share a few different resources and examples you can check out. Again, so this is just one of the this is the Montgomery County Sex Trafficking Protocol. There's one for both minors and adults. Their example is comprehensive and provides a really good model for what a county protocol might look like, especially when you're focusing on the issue of human trafficking. What some of those key agencies should be when creating protocols and establishing the community connection. And then this one really hones in on the special considerations when working with trafficking survivors and their immediate and long-term needs, and then how to best meet those needs. There are also sections dedicated to providing information, again, on what a trauma-informed response looks like to special populations. For example, when responding to undocumented survivors, utilizing immigration resources, and what it sort of also allows you to understand like what legal protections they have. So again, these are just some good aspects of the model to check out as well. And then I wanted to highlight this great resource. OVC's Training and Technical Assistance Center has this anti-trafficking task force and operations guide, which really it's just a great overview of the importance of multidisciplinary collaboration and what elements of a comprehensive task force looks like. And they also include survivor interviews to help the team get that base level of understanding of what human trafficking looks like. So it's a really good tool to check out as well. And then I wanted to highlight this national collaborative group. And, because, speaking of larger collaboratives, again, there's this regional interdisciplinary collaborative to disrupt human trafficking. It's also called the RIC. And we're always looking for members to join. So, and Dr. Sterner will go into this some more later on. But I'll just highlight here the Just Response Council, which some of the RIC members are also part of. But basically, JUST stands for Juvenile Sex Trafficking, and this group comprises of over 30 experts on the issue of sex trafficking of youth from across the nation. There are survivor experts on this as well. And really, they focus on law, policy. They run a national conference every year, an annual conference in DC. So it's really a good group to check out and get connected with as well. And then this is another great resource to check out. Futures Without Violence provides a great guide for building collaborative responses to the issue of human trafficking. They have a whole list of webinars to check out in so many different categories. They have other resources available, and they also have guides for victims themselves and their loved ones as well to understand sort of like what's going on and what resources are available. And then lastly, I'd just like to highlight, I have this Human Trafficking Capacity Building Center. This is a really wonderful tool to incorporate into your project because they provide technical assistance to groups specifically that are starting their task forces, or maybe you're looking for, a specific resource, or if you have any particular questions, they have lots to check out here. And you can always get connected with someone for that technical assistance piece as well, if you're just trying to, navigate this process. And then here are some additional resources to check out. I have them linked here, and we'll be able to get those to you later today. But these resources include a detailed guide on responding to trafficking survivors with substance use disorder. And this is by the National Institute of Justice. This one I really think is important here. It's very comprehensive. And then I included a guide from Future Without Violence, specifically on the topic of collaborating with culturally specific community-based programs to support survivors of trafficking. And then another guide on supporting survivors of trafficking with substance use disorder specifically. This one is from the Office to Monitor and Combat Trafficking in Persons. There's also a great article on their site that I linked here as well, which focuses on the connections between systemic racism and human trafficking. And lastly, I included this research article. You might find it valuable to check out. This one is published in the International Journal of Human Rights and Healthcare, and it focuses on that topic of stigma and what this means for survivors of trafficking. And then it also expands on the cultural barriers in anti-trafficking response. So again, these are all really great resources and toolkits and models to check out when meeting with your team, building that collaboration, establishing your protocol. And if anyone is having trouble accessing these links later on, I'd be happy to share them individually. So I think I'll turn it over to Dr. Sterner now, and he'll expand on human trafficking and substances and share a bit about his research.
Fantastic. Can you hear me okay? Wonderful. Sorry, I was having some technical issues getting on in the beginning. So, Zozan, fabulous work. Really great that you were able to share all those incredible resources, particularly around supporting victims of human trafficking. And as they may present with some substance use issues, particularly in the responses and that support process. And so, my work specifically is at the intersection of human trafficking, um, gambling related issues, and substance use related issues in the community level. And so I'm an assistant professor of criminal justice at Penn State. I work specifically addressing substances, which actually is what drew me to this work, understanding that intersection exists. And so what we're going to talk a little bit more about today is as we're starting to think about this from the community level, from developing those responses and understanding how it is that we can address human trafficking and substance use at the same time. One of the things that I want us to really be thinking critically about is as we look at the community level, how it is that we can develop the appropriate systems for identifying and then also moving into that level of supporting those victims once they have been identified. And so I come at this from both a criminal justice perspective, but also a public health type perspective. And so, Zozan, if you want to move to the next slide. And so, Zozan has really talked a lot about the importance of individuals who may present with substance use disorder, particularly if they have been identified as victims of human trafficking. And so the real question really is this common? Do we see this occurring? Do we see human trafficking and substance use trafficking occurring at the same time? And frankly, we do. Now, I will note that not all human traffickers are drug traffickers, and not all drug traffickers are human traffickers. And so it's important to understand that nuance, because there is that Venn diagram, and that intersection between these groups is really important for us to be thinking about, particularly as we examine community-based both responses, but also detection mechanisms. And so in recent studies, we've identified that in some cases, 28% of human traffickers were charged with just drug possession in and of itself. And then 12% of human traffickers were charged with the drug distribution. And in a separate study, 23% of traffickers were selling drugs. So we do see that there is evidence that these criminal activities are overlapping and that there are overlaps within these networks. But again, like I said before, it's not every single experience that you'll find human trafficking victims, and not every time you'll find drugs or drug trafficking. Next slide, please. But what makes individuals who are either using substances already or at risk of using substances is because that this is a really unfortunate opportunity for exploitation. And so we typically see that there are two approaches that traffickers, particularly human traffickers, use in the exploitation of individuals who use substances. And so first, we see that traffickers typically exploit existing substance use vulnerabilities for recruitment. So for example, if you are someone with a substance use disorder or someone who is using substances recreationally, you may become indebted to an individual who then might be also connected to human trafficking or human exploitation. And so they exploit that risk and vulnerability, particularly if you are unable to pay for the substances that you need in order to meet the issues attached to your substance use disorder. And then they may recruit you into this opportunity that they see to take care of those types of things moving forward. It is a distinct way that they manipulate individuals into the work that they're doing in their communities and this nefarious activity. And so this is something that we need to be at least aware of and help people who are using substances understand moving forward. The other way is from individuals who are trafficking humans and victimizing these individuals already. And so as we think about human trafficking, one way that they utilize the opportunity for control of victims is through substances. So they may force them to use substances. They may specifically provide them with these substances. And as Zozan specifically indicated, there's a whole range of reasons why individuals who are engaged in human trafficking and are victims of human trafficking might need seek the use of substances in order to address their specific traumas. And we know that that is the case. And so by these traffickers who utilize this as an exploitation opportunity, we know that those victims may present specifically either with substance use disorders, or they may simply have possession. And so it's really important for us as we start to think about these activities and the ways that we identify individuals who are using substances, who are selling substances, who are trafficking substances in our communities, that there may be this overlap. And so by understanding that overlap and by digging a little bit deeper, we can hopefully uncover some of those issues that may occur. Zozan? And we know that this is not something that is simply anecdotal. We know that this is something that is a consistent top risk factor and vulnerability, particularly for sex trafficking, because of the work that is going on through the Polaris Project. The Polaris Project coordinates the National Human Trafficking Hotline data, and in that process, when people call the human trafficking hotline, they ask several questions. They help to understand the context a little bit more, and they identify risk factors and vulnerabilities of those individuals who are presenting, or could be reporting issues of sex trafficking and other types of human trafficking at the national level. And so in 2020, this is the most recent data. But we know that this has been one of the top concerns, substance use related issues, whether that is the use of exploitation or the use of control by these traffickers through that process. And this is a consistent risk factor nationally, and it has been for many years. And so we know that this is something that is not something that it's not something that is rare, and it's not something that is not presenting within human trafficking victim populations. And so this is something that we need to make sure that we are consistently aware of, Zozan. And so when we typically think about ways that we address issues, particularly these more nefarious health and public safety issues in our communities, we identify the issue, we develop our coalitions, and we work across our different sectors in order to be able to do so. And we do this for human trafficking, and we identify our folks. We do this for substance use, and we identify our folks. But what we typically know is that human trafficking and substance use, those folks who are working on these issues in our communities typically are sometimes very similar, Zozan. And so one way to think about the approach to addressing these issues at the community level is finding ways to make sure that there are connections specifically between these working groups or between these community-based committees that can hopefully either work together or potentially even make it in the least find ways to make sure that there are connections across these working groups at the local level. Zozan. And we know that this is an effective approach. Zozan has provided some really great resources before this, but the Office of Justice Programs through the Bureau of Justice Assistance, BJS, NIJ, we know that the Department of Justice has shown that this is an opportunity for us to think critically around how it is that we can address human trafficking across sectors. And so they've done some evaluative work, and they have a great report here that you can understand with regards to the enhanced collaborative model that they've developed to combat human trafficking, and that there are lots of opportunities to then utilize this model at the local level. So, Zozan. In addition, we also know that developing community coordination, particularly at the county level, here in Pennsylvania has been really specifically effective at addressing issues of substance. And so we know that community level coalitions, that we know that organizations that pull together multiple individuals across sectors, both in terms of response, but also detection, there are lots of opportunities to comprehensively address these issues in our communities. And we know that this coalition of support helps to address both human trafficking and substance use. And unfortunately, though, we typically see that these can be very distinct groups that are meeting or duplicating the wheel. And so what we're really hoping for is that there's less of that and more coordination and collaboration across either individuals who are interested in working on human trafficking and substance use issues, or finding ways, like I said, to pull together and communicate across these existing working groups. Zozan. And so one of the ways that we've done so is developing this opportunity called, Zozan talked a little bit about this previously, but the Regional Interdisciplinary Collaborative to Disrupt Human Trafficking. It's a very long name. That's why we tend to call it the RIC. But this was developed as a way for us to think about across our different states within the HHS Region 3, to think about how it is that we can address human trafficking across our various sectors. And so we have pulled together victim services, criminal justice, public health, and the survivor community. And truly, this is a survivor-led entity and organization. It is now a 501c3, a not-for-profit organization that helps to coordinate this work across these states and the District of Columbia. And we are now moving towards a really great self-sustaining experience. Zozan, go ahead. And we are now on our 4th summit that we've held. It's currently the 2nd that we've held in person because we started holding these during the COVID range. But we have a regional summit that brings together these various stakeholders across the region to share knowledge, to share information, to share experiences and find ways to help to connect to meet the needs of survivors and victims across our different states. And so we're actually planning this and coming down to the last few days of our preparation for our regional summit, which will be February 7th through the 8th. Down at the Virginia Commonwealth University in Richmond, Virginia. So please feel free to join us. I see the question around what states are in the RIC, and that is Virginia, West Virginia, Maryland, Delaware, Pennsylvania, and the District of Columbia. So if you would like to learn a little bit more about how it is that we are working together across our various states and sectors, feel free to visit the website. That's the QR code there. And then there's also opportunities there for you to actually join the RIC if you're interested. But one of the things that I wanted to specifically share was an example of an initiative where we utilize local coalitions and local capacity building in order to address substance use that ended up in a human trafficking successful investigation. And this is a project that was supported by the National Institutes of Justice, expanding local drug intelligence capacity through a network format. Zozan. This was instituted in 3 states across the country, Pennsylvania, Missouri, and Tennessee. And this was coordinated by colleagues out of Iowa State University, Syracuse University, and myself here at Penn State University. And what we did was we paired in each of these states a mentor criminal justice agency with a mentee criminal justice agency in a rural location. Rural locations tend to have less capacity for both drug trafficking investigations, but also human trafficking investigations, and just fewer resources in general, as we're probably all aware. And so what we did was we identified 2 agencies in each state that were interested in developing that capacity further. And we then paired them with a statewide agency in each of these locations. And this varied across state to state. In Pennsylvania, we paired them with colleagues at the Pennsylvania Office of the Attorney General, and they helped to connect them to the resources that they needed. And so we identified 2 locations here in Pennsylvania, and they were fantastic. And they worked across an entire year to get access to data, to resources, and to, again, just develop better trainings for their local law enforcement officers to understand how it is that they could identify specifically drug trafficking and engage in drug trafficking drug trafficking investigations. And Zozan? And what we did was we worked in each of these communities for them to develop what we call a logic model. And so it helps them to identify the issue that they are working through, particularly with regards to capacity development. They then developed their project goals and outcomes, what they were then going to work on with the mentor agency, their project activities, and how it is that they would measure those things, and specifically what they were hoping for in the short and long term with regards to outcomes. So, Zan. And so in the 3 different states, Missouri really focused a lot on training on Cellbrite for counties. And so utilizing that as far as a data source. In Tennessee, they really focused more so on this increased use of computer communications technology between patrol and narcotics officers, finding ways to share communications with local departments, and the creation of a canine unit. And here in Pennsylvania, our 2 agencies really this is thanks to the Pennsylvania Office of the Attorney General. They really focused a lot on developing coordinated intelligence techniques trainings, but also making sure that they had really key support for IT, so information technology infrastructure, and making sure that they were aware of all the resources here in Pennsylvania across the entire state. Go ahead, Zozan. And so in so doing, one of our locations actually identified through an investigation into drug trafficking, identified an existing local human trafficking enterprise that had likely been going on for decades. And by gaining greater access to local resources, by extra local resources, and finding ways to connect with organizations outside of their communities, they were better able to understand how it is that they could detect and utilize the intelligence that they were gathering locally for disrupting drug trafficking that might also be connected to human trafficking. And so through this coordination and through this collaboration, they were then able to identify that individuals were being controlled with substance coercion. So they were specifically coercing individuals who were active in their use into human trafficking activity. And this was solely identified because of the connection to that mentor agency. And then through that process, they are now in working through the adjudication experience. So they are prosecuting this criminal activity, but they were also able to identify victims and make sure that they were getting into the help that they needed, both in terms of trauma and trauma-informed support, but also specifically substance use treatment and substance use related support as they were working through their process and making sure that these individuals were no longer being victimized by this human trafficking organization. Zozan? And this is just a reflection that we collected as we were discussing this with the law enforcement agency officer at that local level. And this just, I think, highlights the importance of making sure that we are developing these important connections across locations and outside of the communities, and how it is that we can make sure that we utilize these partnerships. And so he indicated that because of this investigation, it's probably been going on for decades, in excess of 30 years. But this was their segue into it. So the individuals who are engaged in this activity are very good at hiding it. They might not necessarily be detected unless you're specifically looking for it. And so finding ways to make sure that we're connecting investigations between, like I said before, substance use related trafficking activities and human trafficking experiences, the more better we're able to meet the needs of victims, and then hopefully connect those victims directly into the services that Zozan had been talking about previously. But that only occurs when we're aware, and it only occurs when we're, like I said, recognizing that this potential could exist. Not that it always exists, but it could exist.
Okay, and then I also have my contact information here if anyone needed to see our references, and we'll go through any questions if we have any. Thank you, Dr. Sterner. That was really great. So I do believe we'll be able to share our slides. Yeah.
Oh, I saw a question. What is Celebrite? It's a computer program that allows you to get access to data on cell phones.
All right. If anybody thinks of any questions after today, feel free to send them to us, or we can get them over to Zozan and Dr. Sterner if there are any outstanding questions. Dr. Sterner, I think there's a question just came through. Is there a virtual option for that February conference?
There is, and you can still sign up for it. It's a hybrid format, both in person and online. And by the way, the agenda for that meeting, I think, is up currently on our website, and it's really robust. It's across 2 days, so lots of opportunity to connect with colleagues.
Great. If there's no further questions, thank you so much to Zozan and Dr. Sterner for being here today with us. It was very informative. Thank you so much. So we will kind of transition now over to kind of opening the floor for anybody else on the call that has any questions about the protocol guides. If you'd like to kind of discuss where you're at in the process, share anything. Looks like one question just came through about sending out the slides. We will get those out most likely within the next, I'd say probably 2 weeks or so. We will get those out to everyone along with the link for this that we'll have up on our YouTube channel. So you'll be able to have a copy of the recording as well.
I think most of what is in the, sorry, just answering one of these questions here. Someone asked, are all the components in the protocol required? Are there pieces that are optional? I do think that there are sections where it's more so like these are considerations. So do with that what you will. And I can go ahead and put in the link for the conference in the chat here really quick.
Thanks, Zozan.
Oh, this is Natalie from PCCD. So if you're new to the protocol guidelines, if you take a look at the introduction, it explains how to use them. The required pieces that should be in every protocol, I believe, are in like a blue font. And then we also know that the protocols aren't one size fits all. So you have to look at your particular project, your particular community, the types of initiatives you're engaged in, and then judge for yourself which pieces of the protocol that are optional should be included in your county's protocol. And also, if you have questions or anything, feel free to contact me or any of our staff here at PCCD that work on the STOP grants. We'll be happy to talk through that with you. That was a good question, and thank you.
I see Allie has her hand up. Allie, if you want to unmute and ask your question or put it in the chat, whatever you want to do.
Yeah, thank you. I appreciate it. So I had actually participated in Dr. Sterner's workshop at the Rural Trafficking Summit at Penn State in, I think it was like October, and I found the information to be really helpful and transformative, and it really put a fire under our victim service staff who attended in trying to begin to build these collaborations. We come from small rural communities. I think one of the things that we found out when we came back, all excited to talk about not duplicating efforts, working in conjunction with drug and alcohol, it almost seemed like it really overwhelmed everybody that we talked to in the drug and alcohol field. That almost like we were talking about adding or doubling their efforts or services rather than working in conjunction. So I would be really grateful for any insight from your experience that you could provide on starting these conversations in a way that doesn't overwhelm already overwhelmed systems.
First of all, Alyssa, thanks for the kind words, and that was just a really great meeting that was put on by the Pennsylvania Office of Rural Health. So again, thanks for joining us. One of the things that I am excited to let folks know is that I was contacted by colleagues at the Department of Drug and Alcohol Programs, and they are currently working on developing trainings for their SCAs and other individuals that are attached to the drug and alcohol, particularly the treatment field, but also just the drug and alcohol field in general. And so know that it seems as though they are recognizing that there's this clear need, and they're really responding to that through some of their training opportunities. But as you're thinking about this from the local level, one of the things that it can be really overwhelming, right? Like adding another thing that we need to be watching out for, something else that we specifically might want to think about screening for as we are engaged in treating individuals with substance use disorder or substance use issues. It can be a little bit daunting. But one of the things that I think that helps people understand this is that simply being aware and simply being knowledgeable that this activity exists doesn't necessarily mean that you're going to have all the answers. And there are individuals who are likely, again, this is no offense to the folks in treatment, but there are likely individuals that are attached to those resources that Zozan shared that can be a great referral. So it doesn't necessarily mean that they have to have all the answers and that they need to understand all the existing resources, but there are opportunities then to develop either trainings, or there's the potential for, particularly if you're at the local level, developing out that protocol of so what happens if you do identify someone with human trafficking experiences. And we can share resources, we can share quick guides, we can share those types of things that will allow folks to understand that, again, you don't have to have all the answers, but you can at least find ways to help report and hopefully ensure that they can connect them to resources accordingly. Zozan, did you have anything else that you wanted to add there too?
I think you covered most of that. Yeah.
Did anybody else have any more questions? Either for Dr. Sterner or Zozan, or anything that we can assist with anybody with the protocol guides? Okay, I see that a couple people here are requesting in the chat to make sure that they are on the list to receive these slides. If you're not sure if we have your email, feel free to either put that in the chat or to reach out to one of us at PCCD. Yeah, we, like Mike said here in the chat, we can cross-reference our contact list here and make sure that we do get you added onto that. Just one more thing, we will be scheduling the next virtual check-in for the end of February. The invite for that will probably go out very soon, so kind of be on the lookout for that. For that one, we will be focusing on language access services. And in the meantime, if anybody has any questions or anything, feel free to reach out to anybody at PCCD, and we can include those questions in our next protocol check-in, or we can get you that answer directly if it's something that is time sensitive. Did anybody else have any other questions for today? Okay, did anybody else, Natalie, Tanya, Mike, anything that you'd like to add for today?
Just as a show of hands or reactions or whatever you do on this particular platform, but I'm just wondering if the group would find it useful if PCCD maybe could work with Zozan and Dr. Sterner to try to reach out to the appropriate people at the state level for drug and alcohol services, just to kind of give a 101 of how everything works. Because I know myself, I'm not very knowledgeable about that system. And if the folks on the call would find that useful, we would be glad to pursue that as another training under these check-ins. So if you could just give us a hands up or something, or a thumbs up, and then we could figure out if that's something people would like. Okay, I mean, there's enough people to have their hands raised that I think that's a yes. So I can't guarantee when this will happen, but that will be in the works for the future. Okay. Thank you. And I guess until next month, I hope you have a good month. And in the meantime, if you need anything stop related or protocol related, reach out to me and my staff and we'll be happy to help. Thank you.
Thanks. Have a great day.
Yes.
Take care.
Thank you.
Mhm.